Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. I have one of our young cardiologists who just joined us here today. Dr. Dedric Clarke has joined us here. He's going to start his practice soon. We're going to get him to introduce him where he's really from, back Vacherie and places like that.
That's
Why
right,
don't you introduce yourself?
Well, good morning. My name is Dedric Clarke. As Mr. Stock alluded to, I'm from back Vacherie, Louisiana, born and raised. I went to Vacherie primary and elementary school, wound up graduating from E.D. White here in Thibodaux. Played football here at Nicholls State for a few years, and I'm a proud graduate of Xavier University in New Orleans, and subsequently matriculated to LSU New Orleans for med school, and did my med school there, and again, a proud LSU graduate of LSU internal medicine in Baton Rouge, and did my cardiology and then subsequently electrophysiology training also at LSU in New Orleans.
Amazing amount of training, young man. Amazing. I knew you before that and you had a head of hair. I can see why it's not there anymore, but I'm one to speak about that.
Yes, sir.
But why don't you give an overview? What is an electrophysiologist?
So an electrophysiologist is at the base, a cardiologist who has then specialized to evaluate and treat different issues that are specific to the conduction system of the heart. You cannot turn on TV nowadays without seeing a commercial about atrial fibrillation. AFib is a condition that's the most common arrhythmia in the world. Electrophysiologists, when necessary, it is not always necessary to do procedures on people, but when necessary or when appropriate, we'll do a procedure to try to address arrhythmias. I mentioned AFib, but there's other different types of arrhythmia. We also do procedures for patients who have perhaps too slow a heart rate. So we put in pacemakers for patients who need pacemakers. Some patients need defibrillators if their heart, what we call the ejection fraction, or they have some component of heart failure, or they have other things that put them at risk for sudden death. We treat those type of things with a defibrillator. So there's a wide array of different things that electrophysiology and that I do, from procedures to evaluations to prescribing medicines. I would be remiss not to even say that there are some things that can be addressed just with conversations with the patient, encouraging people for weight loss or encouraging them to be evaluated for sleep apnea, et cetera.
Well, that's really interesting. Great stuff. You touched on a lot of things there that we can follow up on in the future. And really, it's a pretty special thing to have you here. Once again, thank you, and we look forward to talking to you further.
Yes, sir.